Thank you for joining us for the final presentation of Best of the Bump. Let me begin this journey by telling you some of the most common problems faced by pregnant women in India. Moti Devi, delivered on the way to hospital due to last-minute referral. Child could not be saved. Nilima, her family had to run pillar to post and spend a lot of money to arrange the desired blood units during her C-section. Helene is one of the 50 other women which her gynae attends every day. Hence cannot clarify her doubts and is dependent on age-old answers from the unaware society. Jaspal is struggling with limited budget for his wife's delivery as a lot of money has already been spent on the antenatal test and scans from various places. Despite 15% rise in institutional delivery, 167 women per 100,000 live births are still dying. With over 25 million annual births in India, 65 to 70% in private centers, women experience very poor quality of maternity services, largely due to a fragmented and opaque healthcare system with low accountability and lack of credible and unbiased information, guidance and counseling, leading to poor health outcomes and unusually high cost. Expecting mothers in India have very low awareness about health. There is no platform which can provide unbiased information or guidance. They don't know where to go and who to talk to when in need. During the pregnancy, they have to run to different places to avail services, highly dependent on their doctors for any service or information who are mostly motivated, hence unable to take best decision for herself and the child. The service providers like doctors, nursing homes and healthcare providers' ability to provide high quality care is limited due to very low doctor-patient ratio, no time to judicially address each patient and issue. There is no communication system with the customers. Poor data recording leads to challenges for clinical diagnosis. No real-time data for intervention and future planning. Responsible to generate sales, hence conflict of interest. High marketing cost for attraction and retention. Cost of services for women is inflated due to large and ineffective marketing spent by providers. Hi, I'm Pankhuri, founder and CEO of Best of the Bump. Our solution is a cloud backend mobile app delivered to healthcare providers and expectant mothers through our partnership with hospitals. It consolidates all records, treatments, and services provided, recommends the best treatment paradigm individualized for each expectant mother, resulting in better outcomes and lower cost for her as well as better compliance and sales of more services for the providers. Best of Bump counselor registers every woman visiting the doctor at the center. She acts as an interface between hospital and the patients. She promotes them to download app and enables digital record keeping. Best of Bump server then creates a unique profile for each pregnancy. Based on the profile, the interventions are made by mobile phones and the counselor. The app provides right information, easy access to right care package and most cost-effective healthcare guidance available around them. Similarly, the system maps hospital resources and creates risk profile calendar, which helps in advanced planning, preparedness, resource allocation, increased outreach, easy access to AMR, better data management, new and repeat sales, increased visibility, and direct reach to the target customers. Out of all the services provided by the maternity center, they are able to sell only 60%, which includes consultation and delivery charges. Expectant mothers usually choose other providers for rest 40% of the services, which includes investigations, ultrasounds, and infant vaccination. By creating bundled value packages, Best of Bump sells all the services available at the center, increasing the value of services sold by 25 to 30%. Also, we assure early patient lock-in with advance payment resulting in better cash flow for the center. Apart from the services available at the center, there are other products which target the same customer. Best of Bump resells those products to same customers. Hence, we generate revenues as sales commission from service providers for services and products purchased and paid by expecting mothers. By creating a big and only network of maternity care services, we save tremendous marketing money spent by different service providers to reach the same client through different sources. Our partners love our services. Best of Bump provides unified information and access to services that optimizes the likelihood of a healthy pregnancy and a healthy baby. It also provides qualified self and wellness tools which enables tracking, monitor adherence and coaching. Clinical transparency enabling users use healthcare services more appropriately with more informed decisions. Convenience by providing single point of all services, communication, portable data and record keeping. Financial transparency by comparing prices, benefits, services, ability to select right doctors and service providers. It also helps save 10 to 25% in overall maternity. For OBS and Gynae, the system helps in improving pregnancy outcome and higher patient satisfaction. Easy access to relevant patient health record and better patient management. Self-educated patients leads to reduced doctor time and increases the ability to address more patients. Complete data access means better clinical diagnosis and intervention results in 20 to 30% savings of time, hence increased ability to earn. The maternity centers are benefited with improved pregnancy outcomes and higher patient satisfaction. Overall increase in sales basket with value bundle packages. Early cash flow and patient lock-in. Increased efficiency by reducing manpower cost at each center. For Best of Bump, customer acquisition cost is very low with complete ownership of platform which opens multiple revenue streams and creates ability to capture 90% of the private sector institutional deliveries in India. Now let me tell you about the results we have produced thus far. It really works. Best of Bump kiosk with a counselor is set up at 4 centers. 20 hospitals are provided with app and call center support for timely alert and interventions. 90 high-risk pregnancies were identified and required interventions were made. 10 cases were referred to facilities with NICU for delivery and better care of newborn. 30 units of blood were arranged before time to avoid last-minute and midnight crisis. 90 bundled birthing packages worth $100,000 were sold, approximately 20% saved in maternity spent, 25% increase in total value of services booked through Best of the Bump. Best of the Bump has impacted more than 2,000 pregnancies till date. There are many pregnancy apps with generalized advice and interventions where engagement is done on the basis of content and due date, and the enterprise solution which only helps hospitals in smooth management. Best of Bump provides personalized advice to expecting mothers. It integrates clinical health data real time, offers bundled value packages for the services required. We also have co-branded presence of services and platform with service providers. An overall integrated system. Has adaptability to work in low resource setting which eventually will impact the bottom of pyramid. Best of the Bump is committed to improve maternal healthcare by seamlessly connecting women and healthcare providers. Our management team boasts operational excellence, technical acumen, financial expertise, and we have big plans for the future. We see ourselves expanding into new market segment and geographical locations. After establishing our values and operational excellence with the doctors and hospitals, we penetrate complete women reproductive healthcare system. With the help of Flow Plus app, we'll be able to track and predict menstrual health of women and connect them to the nearby facility, offering them best services available. We expect to break even in 19 months and scale to 500 Best of Bump connected centers in next 5 years. With over 200,000 deliveries, revenue of $11.5 million and net profit of $5.5 million by the 5th year. After having validated our operating model in 4 maternity centers and serving over 2,000 pregnancies to date, Best of the Bump is seeking $400,000 of equity funding to expand the coverage in its home market, that is Delhi NCR, to 100 plus healthcare centers, and continue to develop the backend technology. That investment will enable us to serve 55,000 pregnancies and 0 to 3 months post-delivery mothers per year in Delhi NCR. Achieving operational break-even in 16 months from investment and generating revenues of $2.7 million with free cash flow of $1.3 million by the end of year 5, resulting in measurable social impact with better health outcomes for mothers and infants and improved treatment compliance and decreased costs for healthcare centers. In recent impact studies, something I would like to share with you. Sonia Jan, who availed our services, says, "We had no idea about those 9 months, but with this app the journey was very comfortable. It guided me at each step about do's and don'ts. We could save a lot of money as well. Thank you so much for being there." Apart from businesses, the service providers are also creating impact in their individual capacities. For example, my own hospital says, "We are adopting a nearby village to provide accessibility to the quality healthcare due to our increased efficiency and ability. The expecting mothers are satisfied and more confident about their pregnancies and the transparency in the services." I hope that you join us in creating an affordable, accessible, and transparent maternity healthcare system with us, impacting millions of deliveries in developing countries like India. Thank you.